Many of the classical methodologies used in Okinawan martial arts have been kept secret from the general martial arts public. These methodologies all play a vitally important role in allowing the karateka to apply his art in a real-life situation. A great deal of secrecy has always surrounded the martial arts. The purpose of this secrecy was to allow practitioners with inside knowledge to always be able to defeat practitioners who were not taught the secret or advanced material of a particular style. To some extent, the art was sometimes intentionally sabotaged. The motions of a technique were taught, but often the interpretation was sometimes mistaught. This was done in order to allow only the most dedicated students or immediate family members to have a deep understanding of the combative principles of the art. The withheld material relates to the ki system, or energetic system of the human body. Methods of disturbing the opponent's energy in order to cause damage and consciousness or even death were studied. Instructions for enhancing the health and strength of one's own body through ki exercises were also addressed. Together, these two areas of study form a single theory of combat that is highly effective at protecting one's own life and the life of others. This tape is intended as an introduction to this hidden material. Okay, the first thing we're going to look at are some basic bonkai for the Kyo and Waza, or basic techniques of Okinawan Karate. When we consider bonkai, the first thing we have to think about is distance and timing. Bonkai requires that techniques be applied at a realistic distance with realistic time. First thing we have to think about is what distance do real fights take place at. Most real fights take place at approximately 3 feet away from the opponent. This is the distance at which most people will naturally stand when they're discussing something with somebody. It's also at this distance that an argument may start. So if I was starting with an argument with Eric and I lost my temper, this is the range that a fight would start at. If I was arguing with Eric, I could start a fight by simply pushing him or just taking a sucker shot at him, kicking him, things along these lines. Very rarely would I bring my guard up and start from a distance. And if I did do that, which only happens rarely, the worst thing Eric could do would be to reciprocate and also go like this. At this distance now, we're playing a game. This is no longer the best way to approach bonkai. If I did this, he would do the best thing to maintain the distance. In other words, he'd move in with me. But in any event, like I said, that's actually a rarity. Most fights will simply start when we're this close in. I'll simply punch at him, I'll grab him and punch, or I'll push, things along those lines. So this is the distance we're going to approach our bonkai with. At this distance, if he's going to try and apply uchi-uke as a block, so he's going to reach across his body and block this way, or chudan-uke, or uchi-uke as it's also called, we're going to explain why this perhaps is not the best application for that movement at this range. I'm going to punch. I'm going to stand just outside where I can reach him comfortably. So I actually have to turn, or I have to take a half step forward to reach him. And he's going to respond by doing chudan-uke, by reaching across his body and then blocking my strike. So I'm going to punch mid-level, and he's going to try to block. Go as fast as you can, try to block as best you can. All the way across. Okay, that's with the turn. Now I'm going to take a half step as I do. Okay, and you can see that those were all making firm contact. But you could also see that I would make contact. He already got his hand across and started to get his hand up. So what that suggests is that he does have time to bring his hand across his body before I can punch him. The problem is that he's using two motions, whereas I'm only using one motion. He's reaching across his body and then back. All I'm doing is just reaching straight out. So he has to go 1, 2, whereas I only go 1. And you can see that he cannot possibly do two motions in the same amount of time. I can only do one, especially when he has to start last, because he doesn't know what I'm going to punch. So there's no way for him to possibly get all the way across and then back. If he was to punch at me, and I was to do uchi-uke, you can see that I go 1, 2. Go ahead again, please. 1, 2. If I do shuto-uke, you can see I'm actually bringing my hand away from his punch. I bring it away, then back towards. The same thing would apply if I did Gedan. He punches to the groin. I bring it up. I actually bring my hand up towards my ear, or even in the Shoden styles, which is chamber on the arm, I actually bring it up and away, then back towards. I can't bring my strike or my block away and then towards the target and actually expect to hit it, or at least not to hit it when it's on the way. A lot of people say that we do this motion for more power. More power is really great, but if I have more power and I've struck his hand on the way back from my shattered teeth, more power hasn't done me a lot of good. If I use more power, I want to use it in a way that actually benefits me, and that isn't going to be by hitting his arm when it's on the way back. So he comes in, I go in this way, and then he starts to pull out, and then I wind up hitting his arm. That's not going to work. That just isn't going to cut it. So what we have to do is think of how these blocks were intended, or I should say these ukewaza were intended to be used within this distance and with this timing. As we mentioned before, he does have time to bring his arm across his body. So we're going to try to downstrike that now. I'm going to punch the same area, and he's going to block by bringing his hand straight across. And this time, I'm going to still try to maintain the speed, but you can see a difference in his response. Okay, you can see that I'm punching just as fast, but I only hit maybe once or twice. And the difference was that he had a shorter distance to travel. You can see that now he's actually blocking in what would be the beginning motion, uke, or chudan uke. So from here, you can see that if he finished, go ahead and finish. And he stepped forward just like you would in application in kata. You can see that he's bringing his hand across by my face. So what that means is that after I've blocked his strike, I can easily step forward and strike him, actually his body. So now, not only have we countered, we've also struck him. But you can see that now we're still only using one hand. But chudan uke, as it's performed in kata, has a set position using both hands. So what Eric's going to do is punch in my face nice and slow. I'm going to strike his arm downwards and punch straight for him. And you can see that this motion corresponds with the set position of uke. And this strike this way. I strike the arm down and then strike up. And I'm using my palm to be nice. In application, I can use the ulna. So this in itself would be a strike. I hit his arm this way, it causes pain. I strike up at the same time. But to be nice for the videotape, so that we can do more than one technique, I'm going to be using my hand, just the palm side. But I could use the ulna, I could use the back of my hand, or I could even use my knuckles, any of these to strike the arm rather than just to trap it. So anyways, he punches, and I chamber this way. Boom, boom, boom. Very easy. I can very easily counter and hit in the same amount of time that I was chambering my punch, or I should say chambering my uke. Now, real slow motion, please. I go one. Now, I've only stepped part of the way forward. I'm going to complete my uke as I finish stepping into my pinan-dachi, or shogen kutsu-dachi. You can see now that I'm in the finished position for uke, and I've struck him once, twice, 3 times, and I've grabbed. And I've grabbed on pressure points, so this is an attack in itself. So I've actually struck him 1, 2, 3 times, and 4, that's a grab. I've attacked 4 times. But that's ignoring the footwork. 1, 2, 3, 4, 5. So now I've actually attacked his body 5 separate times in the same amount of time that we performed uke. In fact, it is uke. This is, in fact, the original, or one of the original Okinawan applications for uke. There are others. This is actually one of the more basic ones. But you can see the dynamics of the technique allow me to attack him 5 separate times in the same amount of time that you would sometimes see this used as only a block. So you can see it has 2 separate beats. 1, 2. Don't punch this time. Okay? So just imagine him punching. I want to do a little faster without any danger here. 1, 2. I would use that same motion, block this way. But you can see now, not only have I not struck him at all, but I've actually wasted 2 beats without striking him. So I go from using 2 beats to attacking him 5 times to 2 beats without attacking him at all. And the only difference is, if you watch carefully, I step forward with my uchi-uke rather than stepping backwards. That's the only difference in the technique at all. So it's primarily a difference in distance and timing, not a difference in technique. I go 1, 2, moving backwards, and I've done nothing, go ahead, but move his attack to the side. I step forward, and I've attacked him 5 separate times. So you can see how considering distance is a very important thing to do. Okay. Now we'll talk a little bit, we've talked about the concepts of Bonkai, but now we'll talk about the specific Bonkai, what I'm actually trying to do. On the first strike, I'm going to strike a point that's called lung 6. Lung 6 is located midway between the wrist and the elbow, on the radial side of the arm. There are branches of the radial nerve that are going to be struck. When I strike this, typically what this will cause is a weakening of the hand and the wrist. At the same time, I strike upwards, and I'm going to try to strike what's called the supraorbital notch, or head neck 16, HN16 in acupuncture nomenclature. This is it's looking straight ahead. This is located directly above the pupil on the supraorbital ridge, which is the same thing as the bone of the eyebrow. Directly on the underside is a point called seidon, or seimo in karate terminology, or head neck 16 in acupuncture terminology. What I'm going to do is I'm going to strike and strike at the same time. Striking seimo will usually cause unconsciousness, and even a light strike will cause probably mental stunning. But at very minimum, what it's going to do is cause pain, and that pain is going to trigger a reflex stretching of the neck on this side. This side actually becomes shorter, or not stretched, becomes relaxed. This side becomes very tight, because when I'm struck here, my reflexive response in order to dissipate the injury is to stretch upwards and sideways in order to minimize the force transfer to this area. So what's going to happen is after I've struck this side is going to stretch, making the nerves on this part of the neck very, very vulnerable to a strike. Now I can actually strike with approximately half the force that I would be able to strike in this chin in this position and have the same effect. So I've actually made this technique twice as easy. So after I've struck here, I'm going to use my forearm to strike what's called stomach 9. It's a baroreceptor, and it's located at the level of the thyroid cartilage on the border of the sternocleidomastoid muscle at bifurcation of the carotid artery, where the carotid artery splits into the internal and external carotid artery. This is a baroreceptor. It measures the pressure of the blood going to the brain and the heart rate. When I stimulate this point through striking, the brain, I shouldn't say the brain, but actually the nervous system itself interprets this as the blood pressure rising to an unsafe level. So what the body does in response is cause bradycardia, or lowering of the heart rate, and vasodilation, which means the blood vessels get larger. When the blood vessels get larger, the blood will drop out of the brain into the lower part of the body, which causes sudden hypotension and fainting as a result. When the body faints, it lays out flat and lets the blood pressure go to normal. So what I've done is I've tricked the body into thinking the blood pressure just shot up really rapidly, and that'll cause the body to go horizontal because the blood pressure will drop and it needs to equalize. So what's going to happen is he's actually going to faint from a reasonably light strike to his neck. But the thing is, I didn't only strike the neck. I've also struck the arm, the head, then the neck. I've also stepped on the foot and nudged the leg, and I'm grabbing meridians on the arm. So you can see that what was normally just a knockout is now going to be a much more serious technique. We need to talk about which of the wrist points to use now. Typically, on a normal grab, we'll simply go after the heart and the lung simultaneously. But there are actually 6 meridians that go through the arm and the wrist area. We need to look at all those points and what we can use them for. On this tape, since it is going to be an introductory tape, we're not going to discuss all the different points we can use during each individual technique. We're going to do it once and then let you apply the knowledge in any way you see fit. The first 2 points we're going to use could be lung 8 and lung 7. Lung 8 is located right here, right where the indentation on the radius is. Lung 7 is located right about here on the outer side of the radius. Either of these points can be stimulated by a grind this way or a grind inward. On the center of the wrist is the pericardium meridian, and we can use the 2 points on the pericardium. We can use right here and right here. This point is probably going to be the one we're going to use more often. It's pericardium 6, and it's a very sensitive point and causes a lot of pain, sometimes nausea. Right here we have a series of 4 heart points which can each be used. On the opposite side of the arm, we have large intestine 6, triple warmer 5, and small intestine 6. All of these yang points are primarily manipulated by a twisting grab this way. And very often the surface area I'm going to use is this surface area here to stimulate. So for instance, if I'm going to use small intestine, I'm going to wrap upwards this way. And an example of when I would use small intestine is, say I just did uchi-uke and I sense a punch coming. I'm going to block this way and give a sharp twist here. Camera see okay? So I've hit here, and now he strikes. Now I've activated the small intestine meridian. I'm going to come and strike small intestine on the opposite side. This is small intestine 16, and it's a very, very sensitive point, and it's one of the easier knockouts you can perform. And I've just activated it by doing this twist. And you can see more often than not, when somebody has this twist applied to them, this side of the neck will become slightly stretched. Because of the way the shoulder tries to compensate for the force, this side of the neck becomes stretched. So very easily from here, we just did a uchi-uke. He strikes, boom, I've stimulated it. You can see it's stretched, and I strike back this way, using the edge of my thumb on small intestine 16 this way. Okay, we're going to look at maybe a couple of other ways we can use. The hard points here are really good for going from our Kisho Uchiwaza right into our Tuite Waza. So from here, very often I can simply push on these hard points to bend the wrist. From this wrist bend, I can apply Tuite very easily. Look carefully here. This is not a normal shoulder lock like you often see. You'll be able to see that I also still have maintained that wrist bend. You see the gooseneck? Okay, so from here, I'll go up this way and simply apply the gooseneck chicken wing combination. Or if I don't feel comfortable trying the gooseneck, I can simply go directly into a chicken wing. But I use this heart point to get his body in motion. Otherwise, I can use the same point, again, getting the body in motion, now following up with an arm bar or something along those lines. We can simply keep on the wrist and dump him on the ground. A lot of real simple Tuite techniques follow very easily from stimulating this point. Okay, now we're going to go onto a chart and show each of the points individually and talk a little more about them. The first point we're going to look at is heart 7. It's located directly below this crease on the wrist. This is heart 7 here. Heart 7, heart 6, heart 5, and heart 4 can all be considered more or less a unit as far as Kyushu Jitsu is concerned. Virtually all these points function in pretty much the same manner, and they can all be used pretty much the same way. Heart 5 is perhaps the most useful of the series, but it really doesn't matter which of the heart points that you stimulate. All of them will cause a weakening of the wrist. All of them have motor acute nerve visceral reflexes affecting the heart. So any of these points can be used in approximately the same way. On the pericardium, we have pericardium 6, pericardium 7. Either of these points can be used in very similar fashions. Pericardium 7 is more superficial, but is less painful. Pericardium 6 is located deeper in the wrist, which means you have to actually press in deeper to have the stimulation. But the relative effects are much greater, so it's often going to be the chosen target. Lung 8 and lung 7 again function somewhat as a unit. In fact, their areas of activation actually overlap somewhat. Lung 8 right here is going to be located on the styloid process of the bone. It's going to be just on the inside of the bump. 7 is actually directly on the outside of the wrist. Either of these points can be manipulated with a grinding pressure or with a strike. This is large intestine 5, and it's in the hollow of the wrist, in between the two tendons alongside the side of the thumb. This point really works well for a strike. Digging your finger into it also causes a nice amount of pain. Large intestine 6 needs a very distinct grinding action for it to be activated. A strike won't usually work. This holds true for small intestine 6 and triple wormer 5 as well. Triple wormer 5 is actually, this is drawn a little bit inaccurately. The bump here, this jag, where the 3 points are meet, is actually a little closer here, but this will work just fine. Triple wormer 5 again needs to be ground, as do these two. They won't respond very well to strikes, although a palm strike on triple wormer 5, if the opposite side is also being struck on triple wormer 6, on pericardium 6, works very well to get a yin-yang stimulation. So these two work well together if you're striking them at the same time. But generally speaking, this will be used as a grinding point. Now we're going to look at the points involved in the bunkai for Chudan-uke or Uchi-uke. The first point is located on the Heike meridian or lung meridian. The point itself is lung 6 or LU6. It's located on the palmar aspect of the forearm, midway between the wrist and the elbow, on the radius. It's anatomically the location of the superficial ramus of the radial nerve and the lateral antebrachial cuteness nerve. It's located on the C6 dermatome. Its elemental attribution is metal. Its polarity is yin or yin. Effects of striking this point include a weakening of the hand and wrist with mild to sharp pain. It also has motor cutino-visceral effects on the lung. The next point is HN16 or head neck 16. It's actually associated with the gallbladder meridian and is located directly below the gallbladder 14. Gallbladder 14 and the supraorbital nerve, or head neck 16, are both actually points located on the supraorbital nerve anatomically. It's located on the C2 myodermatome. Its elemental attribution is wood. Its polarity is yo or yang. Effects include a mental stunning or unconsciousness with firm force. Mild force causes pain and reflexive stretching of the neck on the same side. The next point is stomach 9. It's located on it's located on EK meridian, or the stomach meridian. It's located at the level of the thyroid cartilage at the bifurcation of the carotid arteries. Anatomically, it is the carotid sinus, but also at the same location is the ascending branch of the hypoglossal nerve and the vagus nerve, with cervical branches of the facial nerve and the deeper sympathetic trunk. It's the location of the C3 dermatome. Its elemental attribution is wood, and its polarity is yo. The effects of striking this point are vagus-induced bradycardia with vasodilation, which lead to sudden hypotension and fainting. You can see from the 5 element attributions that we're actually going from metal to wood to earth on the destructive cycle of acupuncture. Okay, now we're going to quickly recap Uchi-uke or Chudan-uke. Okay, he punches. We're going to intercept the punch by striking on lung 6 with our ulna. This is a metal strike because we're striking our Heike with the lung meridian, which is a metal point, metal meridian. At the same time, we're striking up to head neck 16, which is associated with the gallbladder, which is a wood meridian. So we've got from metal to wood. From this point, we step forward and strike the stomach, which is an earth meridian. So we've gone from metal to wood to earth. on the destructive cycle of acupuncture. But at the same time, not only is this a good technique from an acupuncture point of view, but it's extremely practical in that the inside line, being the line on the inside of the arm, is almost always going to be unoccupied. There's very, very rarely will there be an obstruction between his hand and his neck, or his hand and his head. There usually will be nothing in between this area. So when I strike here, very often I'm going to make it cleanly without him being able to block, because his hand won't be able to respond in time. So striking on this unoccupied line is a very good way to strike. Now as I step forward, again, I'm also on the unoccupied line, and you can see what I'm going to do is I'm actually going to push him backwards this way, which is going to make it extremely awkward for him to punch. You can see that he's going to actually have a hard time even reaching my head, but more importantly, he's not going to have any power because his body is leaning away from me. So when I strike, not only do I strike his arm, strike his head, strike it again, attack his wrist, attack his leg, I've also positioned his body in a way that he's going to have a very hard time attacking with his other hand. So not only have I blocked his first hand and attacked him 5 times, I've also made it impossible for him to follow up, or at least very difficult for him to follow up. Now watch this leg as I step in. So 1, 2, boom. You can see how it steps back. And that's just for pushing on the chest. If I actually hit the neck, it would step back much more violently. In fact, it would collapse. So what happens now is you can't kick either, because I step on this leg, and this leg is forced back rapidly. So he can't attack with either leg. I'm grabbing this arm, and that arm is put in an awkward position where it can't punch. Thanks. Now we're going to look at Shuto Uke, or the knife hand reception. Shuto Uke, the way it's performed in the majority of styles, this hand will come back towards the head. At the same time, this hand extends forward. Then it retracts and extends forward this way. So they switch positions. The left is out, the right is back, and then they have a switch. This is pretty much characteristic of all the ukewaza. So we're going to look at an application for this motion. As Eric strikes my face, my right hand is going to be my reception. I'm going to strike with this surface area along Heike, or the lung meridian. At the same time, I'm going to stick my fingers forward and strike the eye, or gansei, at the same time. The lung meridian is associated with metal, and the eye is considered wood. So we've gone from metal to wood. Now from this point, I'm going to retract my hand as I did when I performed the ukewaza by itself, and extend forward again as I would when I'm performing this technique on myself. And this again is going to be stomach 9. So both first 2 techniques we've done both end with the strike of stomach 9. 1, 2, 3, 4. And for footwork, it depends on which kata you're doing and where it's in the kata. Very often it's in a cat stance, or sometimes we'll do a forward stance. Of course, some of the Japanese styles use a larger back stance instead of a cat stance, but the body dynamics are about the same. So I strike forward this way, then strike this way. So again, you'll notice when I strike the eye, I'm going to get the same reflex action where I'm going to stretch the neck. His head is going to tilt up and slightly sideways to retract from the pain of being struck in the eye. So I strike the hand up to the head and strike down this way. When I strike this lung point, I want to make sure that my hand rotates slightly this way, sorry. So I'm going to strike at the small surface area with a slight rotation on the arm, weakening the wrist a great deal. Strike into the head this way, and then follow up here. So he punches, one more, this way. So I'm shooting above his eye for safety, but of course you'd be going directly into the eyes with your fingers. Boom, boom, this way. Very easy follow-up is to simply take the arm, again with the second knife hand, into an arm bar. So I go 1, 2, I push slightly sideways, then wrap 3. This can be accompanied with a nice leg kick this way. One more with a slow, boom, boom, kick, tilt, and lock. 1, 2, 3, and lock. So what I'm actually doing, 1, 3. 1, 2, 3. So I'm actually doing knife hand, which appears in many, many kata. So one more time, please. This hand strikes this time. Show it from the outside. You can see how I'm, again, going on the inside line, which is going to be unoccupied. There's going to be nothing to stop this hand from striking. And then carotid sinus, and lock final for a finish. 1, 2, 3, 4. Last time, I strike. Get this nice rotation which stretches and pulls the nerves. At the same time, I strike the eye and finish here. Again, you'll notice when I do this technique correctly, I actually stretch his body in such a way that it's going to make this arm coming forward very difficult. You can't really reach when I perform this technique correctly. But more importantly, if I've struck him in the eye and he's stretched his neck backwards this way, and this is stretched now, you can see, it's very, it gets a reflexive dropping of the legs, and more often than not, a firm strike along these lines is going to cause the person to fall all the way to the ground. And if you did it anywhere near full force, something along those lines, it'll actually cause unconsciousness in most people. So not only is it going to just tilt his body away so he can't punch, but in actuality, he's going to have to punch from the floor. Okay, reviewing the points for Shuto Uke. The first point is located on Heike meridian, or the lung meridian. The first point we're going to talk about is lung 8, but also lung 7. Lung 8 and lung 7, as discussed earlier, can be considered functionally the same point. And which one you'll strike will simply depend on how his arm is oriented. Lung 8 is located near the palmar wrist crease in the depression on the radial side of the arm. Anatomically, it is the superficial ramus of the radial nerve and the lateral antebrachial cuteness nerve. It's located on the C6 myodermatome. Its elemental attribution is metal. Its polarity is yin or yin. Effects of striking it are weakening of the hand and wrist with mild to sharp pain. There are also motor cutano-visceral effects on the lung. The next point is gansei, or the eyeball. Gansei is a wood point, and it's associated with the liver meridian and the gallbladder meridian by virtue of it being a wood point. It's also connected with the stomach meridian directly. So when you strike gansei, not only are you getting wood effects, you're also directly setting up the stomach meridian, which you can see it connects directly to. Striking gansei causes temporary impairment of the sight, a reflex shutting of both eyes, and a reflexive stretching of the neck on the same side. The next point, again, is stomach 9, which is, again, located at the level of the thyroid cartilage on the bifurcation of the carotid arteries. It is, of course, the location of the carotid sinus. Its elemental attribution is earth. It's located on the C3 myodermatome. Its effects include vagus-induced bradycardia and vasodilation, which leads to sudden hypotension and fainting. Again, at the end of the technique, your hikite, or your retracting hand, stimulates various wrist points depending on what your follow-up will be. As far as the Gogyo, or the 5-element theory, we start on metal, which is Heike, the metal meridian, go to Gansei, which is wood, and finish up on Ike, which is earth. Okay, now we're going to review Shuto Uke. Again, please punch right. I'm going to strike, again, on Heike meridian, striking Heike number 8. At the same time, I strike Gansei, or the eyeball. This is metal, and Gansei is wood. So I've gone from metal to wood, and at the same time, I've stretched the neck, setting up the stomach meridian, number 9 here, stomach 9, or Ike 9. So I've gone from from metal to wood, then to earth. But this has another effect, which is nice, because the eye itself is connected directly to the stomach meridian here. And actually, these stomach points in acupuncture are used to treat eye disorders. So very often, something that affects the eye also affects the stomach meridian itself. So when I strike the eye, not only do I set up the stomach meridian in terms of 5 elements, but I set up the stomach meridian directly by affecting its path directly. So from here, boom, stretch, hit. So from a technical point of view, this is also nice because I'm striking what's going to be an unoccupied line with both strikes, and this strike in itself helps to make sure that that arm is shut down. In other words, that arm can't reach me. At the same time, of course, my footwork, I always have to either cover groin in a cat stance or step into aggressive pinan dachi to shut down the legs simultaneously. Now we'll look at Geidan Uke, or Geidan Barai Uke. The strike comes at my chin, and what I'm going to do is move slightly sideways. And at the same time, well, let's discuss why I'm going to do this first. One of the things I want to do now is say, maybe he's going to punch in a way that doesn't have this line open anymore. We've always been going on the inside line now, this way, you know, with whatever type of technique, on the inside line. Let's say the inside line is closed. I'll give you a couple examples. Maybe he punches with his shoulder tucked this way. Now the inside line is closed. Let's say maybe he punches with a guard. Now again, the inside line is closed. So I have to do some type of technique, punch please, that doesn't use this inside line. So what I'm going to do is going to go down here. So I'm going to move to the outside line and strike below this way. And you can see he's not going to be able to protect very easily. For one thing, he can't really even see down here very well, can you? It's very hard. He has to use his peripheral vision, and he can't really see that clearly. But more importantly now, as I step directly in, this line is almost completely obscured by his own arm. He can't really see my punch very easily at all. So as he punches, I'm going to step in and strike his arm and strike his body at the same time. So this is my set position for Geidan Uke. My complete position for Geidan Barai Uke is this way. So I go 1, 2, 1, 2. And it doesn't matter how we perform Geidan Uke. Some styles chamber here, some styles chamber here. It really doesn't matter for the bunkai. The only difference that'll be, if we chamber here, I hit his arm stronger down. If I chamber here, I hit his arm slightly sideways. It really doesn't matter. It's basically the same technique either way. Anyway, so he punches, and I go into my set position this way. So one of the things this does is when I block on the outside, it makes it hard for him to counter on punch. See, he can, but it's harder. So it helps me to shut down this arm. It's not as easy for him to punch across his body. He has to either turn his body or take a step. And if he turns his body, he's turning it beyond what's biomechanically sound angle. He's going to either lose his balance or he's not going to punch with power. If he takes a step, I'm going to have more than enough time to adjust and attack again. So what I'm doing is I'm going to the outside line, which helps to prevent another punch, but at the same time, I'm attacking, which also prevents another punch. Right? So I strike gallbladder meridian and large intestine meridian at the same time. On the arm, I'm striking large intestine 10. Here, this is Daichoke meridian or large intestine meridian. And I strike Tonkei meridian or gallbladder meridian right here. So at the same time, I strike a metal point and a wood point this way. From here now, my hand has to come down in Geidan Barai, so I strike stomach on his body. But at the same time, this hand retracts. Now watch my retraction position. You can see it's right next to his hand. So I'm going to grab his hand on the way back, this way. So he punches, I strike, 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 or grab strike. So I go 1, 2, 3, 4. Now look at my body position relative to his arm. It takes only a small nudge to actually break his elbow. And even if I don't break his elbow, I'll reposition his body in a way that allows me to attack where he cannot attack. So I strike large intestine, then I go to gallbladder. From gallbladder, I go to the stomach and wrist point at the same time. Now all it takes is a little tai sabaki or a little bit of body movement to break the elbow. So I go strike, strike, pull, strike, same time, this way. This way. So Now we'll look at points and what their effects are before we review. Now we'll look at the points for Gedan Uke. First point is large intestine 10. It's located on Daichoke meridian. Its location is 2 inches below the lateral end of the transverse cubital crease in the depression formed by the local musculature. It's the location of the deep ramus of the radial nerve and the posterior antebrachial acuteness nerve. It's located on the C6 or C7 myodermatome. Its elemental association is metal. Its polarity is Yo. The effects include a weakening of the arm and a pain or numb sensation in the eye. The next point is gallbladder 24. It is the gallbladder alarm point. It is inferior to the nipple at the level of the 7th, between the 7th and 8th rib. Its local anatomy is the 7th intercostal nerve. It's located on the T6 or T7 myodermatome. Its elemental association is wood. Its polarity is Yo. Effects include pain in the rib area, a lowering of available ki or energy level, and a winded feeling. Strong stimulation can lead to retching or vomiting and dysfunction of the lower burner. The next point, is stomach 28. It's located on Ike meridian. It's located 3 inches below and 2 inches lateral of the umbilicus. Its local anatomy are branches of the subcostal nerve. It's located on the T11 myodermatome. Its elemental attribution is earth. Its polarity is Yo. Effects include a dull ache in the lower abdomen, a reflexive bending at the waist, possible bladder damage or release, and dysfunction of the lower burner. Again, wrist points will also be stimulated with this technique, and you can see the Gogyo, or 5-element attributions, will follow, again, a metal to wood to earth cycle. We'll go from large intestine 10, which is metal, Daichoke, to Tanke, to Ike. Now a quick review of Gedan Uke. Again, he punches. I strike large intestine 10 on Daichoke, and I strike Tanke on gallbladder 24. Now, immediately after doing this, I retract my hand and catch the wrist at the same time. I strike stomach 28 on Ike meridian this way. So I go from a metal point to a wood point to an earth point. So again, he punches, boom, boom. One more time. Now from here, I can break the arm very easily. If I don't break it, at very least it causes a change in body position, which can allow me to very easily finish him up this way. By taking this next step, I go from earth now to striking water and catching water on the inside of his leg for a sweep. But just the technique itself, we end up with an arm break. Thank you. Now we'll take a look at Oizuki, or ski. The application of ski is going to be from a middle level tate ski. He punches at my body this way. He's going to strike my solar plexus with a tate ski, but it could also be this type of twisting punch, it doesn't matter. Anyways, he punches at me, and I'm going to intercept with my ulna as if I'm punching forward this way. And the strike, again, Daichoke, large intestine, the number 7 here, inward this way. And at the same time, on the opposite side of his arm, I'm going to strike with my retracting hand this way, striking pericardium here. So I get a nice fire metal strike this way. Pow, pow. So what I'm going to do is I hit here and here. So my ski actually intercepts his punch and blocks it, but also strikes his arm twice and then strikes into the body. So as he strikes, I use my punch as a block, try to hit this way. You can see how I'm actually blocking his punch and punching at the same time. But I don't want to just stop there. I want to strike on the opposite side too, this way. But you see that hurt. He moved a little bit, but it didn't hurt as bad as it could. The reason for that was that I struck straight in this way. What I want to do instead is strike back. That's why our hand twists and comes all the way back. For one of the reasons, there's other bunkai, but one of the interpretations can be that I'm grinding and pulling on the nerves. So when I strike, this way hurts. This way hurts a lot more. Sorry. So what I'm going to do is now strike inward this way, and then strike this way. But you noticed, well, I don't know if it shows up on camera, but what I'm going to be doing at the same time is stepping on his foot. As he punches, I step in and strike his, or compress a nerve on his foot here. This is liver 3, and it's a very sensitive, very painful point, and will help to mobilize his foot and cause a lot of pain. So, again, looking at the technique as a whole, I strike fire metal, then go down to the foot, wood, apply weight forward, now going up again, strike stomach on the chest. So we've got fire metal, pericardium, large intestine, and at the same time move in, step on the foot, liver, then stomach, which is earth. So fire metal, wood, earth. So one more time, this way. And notice I'm using the flat disc, but in application, I would strike here, either going at number 14 or number 15 on Ike here. Flat fist is sometimes painful, but it's not the actual striking surface. The actual striking surface is kaikoken, and it's striking this way, or this way. So when you see him reflexively responding, you can understand that actually his response is going to be much greater when I strike with kaikoken. So one more time, last time, strike this way. Now I've struck twice on the arm, once on the foot, and once on the chest. Striking the stomach meridian in this area actually affects the heart, and when I use kaikoken, it can actually result in unconsciousness or possibly death. So on the left side especially, this is something that you don't really want to play with the small surface area this way. In fact, you probably don't want to hit the left side of the chest at all. Looking at oiski, or oizuki, or ski, first point is located on the pericardium meridian, or shinpoke. It's shinpoke number 6, or pericardium 6. It's located 2 inches above the transverse crease of the wrist, between the tendons of the long palmar muscle and the radial flexor muscle. Its local anatomy includes palmar branch of the cutanous branch of the median nerve and the anterior intersorosus nerve. Its myodermatome is C8. Its elemental attribution is fire. Its polarity is yin or yin. Effects include strong pain, a weakening of the wrist, strong stimulation can cause an upset of the stomach, a lowering of the available energy with motor cutano-visceral effects on the heart. The next point is large intestine 7 on Daichoke meridian, or the large intestine meridian. It is 5 inches up from the dorsal side of the wrist on the radial side of the forearm. Its anatomical association is the deep ramus of the radial nerve and the posterior branch of the antebrachial cutanous nerve. It's located on the C6 dermatome. Its elemental attribution is metal. Its polarity is yo. Its effects include a weakening of the hand and the wrist with mild to moderate pain. The next point is liver number 3. It's in the depression of the distal, it's in the depression distal to the junction of the first and second metatarsal bones. It's the branch of the deep peroneal nerve anatomically. It's on the L5 or L4 myodermatome. Its element is wood. Its polarity is yin or yin. Its effects include pain and immobilization of the foot. The last point in acupuncture nomenclature is stomach 15 or stomach 14. Stomach 15 is located in the second intercostal space on the mammary line. Its anatomical association is the anterior cutanous branch of the thoracic nerves and the medial pectoral nerve. It's on the T2 myodermatome. Its elemental attribution is earth. Its polarity is yo. effects of striking this point include pain in the chest, and a strong stimulation leads to unconsciousness and negatively affects the heart. Looking at the five-element theory, or the Gogyo, you can see we start on fire, move to metal, then to wood, and finally to earth. So we start at Shimpoke, which is fire, move to Daichoke, which is metal, then to Kanke, which is wood, and then back to Ike, which is earth. Now we'll review Oizuki, or ski. Punch this one this time, please. When the punch comes, we're going to block by striking Daichoke. Daichoke 7 here, and Shimpoke, or pericardium, number 6 here. At the same time, we're going to step on the foot. And you can see that when I step on the foot, moving forward this way, I'm actually going to be stimulating liver 3, which is located directly here. This is a very painful point, and will actually mobilize the foot when I compress it this way. This will prevent him from stepping, which we'll show in a minute is actually a very dangerous thing. So now the punch comes, I strike, and then strike, and I can see that he loses his balance badly because I've immobilized that foot. When he falls after the strike, it's actually going to probably break or badly dislocate his ankle. So in actuality, not only is this strike going to cause unconsciousness, but it's going to cause a very bad sprain at the very least. Now we'll do it on this side, which is the actual side that would be done mostly on. If you look at your kata, you'll see that you have almost twice as many punches to the left side as the right side, and that's simply because striking the left side of the chest is more dangerous than striking the right side. So naturally, for self-defense purposes, we would want to strike this side more often. But for class, we don't want to strike this side at all. I'll do it in this demo only for educational purposes. Please don't replicate this. You can see now when I'm striking, I'm going to strike both sides with equal force, and you can watch the effects yourself. I'll stand up. Sometimes there won't be a difference in pain. Please don't try this, just take my word for it. Sometimes they'll hurt exactly as much, but almost invariably this side will move back more because the body naturally wants to protect the left side of the chest. Stomach 15 is located approximately here, stomach 14 approximately here. Either point is acceptable. This point here, stomach 14, will probably have less muscle to penetrate, but its effects typically aren't as strong. So depending on how strong your kaikoken is, 15 is the preferable point. But if the person has a muscular chest or your kaikoken isn't very strong, this point might be the preferred time. Okay, now we'll move on to kicking. Now we'll look at Maigeri, or front kick. We'll use Maigeri in response to a groin attack or a leg attack. Kicks at my groin, and I use my set position to intercept his kick. What I'm going to try to do is target number 6. At the same time, I'm going to, or immediately after I should say, I'm going to kick to spleen 10. And as I do that, I'm going to grab his hand and turn his body slightly. But the kick itself will turn his body too. This kick this way will turn his body. But just to help guide, I'm going to make sure that he turns by pushing on his arm slightly this way. Then I'm going to follow up with a strike this way to the back of the head. Don't kick this time. And what this is doing is simulating a guard position, which is what normally Maigeri is performed at. Alternatively, a punch is also used with Maigeri, but we're just going to use the guard position for this particular monkai. This way. You can see that this hand comes out slightly first, which is quickly followed by this way. So, this way. Now he kicks. Boom. And you can see my reaching action is grabbing the hand, following up with a strike to bladder, this way, bladder 10. So he kicks, I intercept on liver, kick, and follow up. Now, for video purposes, I'm using the bottom of my foot. He kicks very nicely this way. with the ball of my foot or my heel or whatever. But in actual practice, what I want to use is my big toe, which is a very small surface area and extremely painful to get kicked in. I'm sorry. Obviously, I can't do that every time, so I'll just do it those two to demonstrate. And now I'll go back to using the ball. But bear in mind that it would normally be the toe. Kick, strike. So I go from wood to earth to water. And we'll look at that on the chart. Thank you. Now we'll look at point locations for my yeti. The first point is LV6 or liver 6. It's located on Kanke, or the liver meridian. It's 7 inches up from the tip of the medial malleus and is located on the tibia. Its acupuncture nomenclature name is LV6, and it's anatomically the location of the branch of the saphenous nerve. Its myodermatome is L4. Its elemental attribution is wood. Its polarity is yin or yin. Effects include pain and weakening of the leg with a possible broken tibia. The next point is spleen 10. It's located on Hike meridian, and it's 2 inches above the medial superior border of the patella on the bulge of the medial portion of the quadriceps muscle. It's anatomically the muscular branch of the femoral nerve, and it's located on the L3 or L4 myodermatome. Its elemental attribution is earth, its polarity is yin, and its effects include pain and weakening of the leg and the reflexive turning of the body. The last point is bladder 10 on Bokuke meridian, or bladder meridian. It's located just within the hairline on the lateral side of the trapezius muscle. It's anatomically the trunk of the greater occipital nerve, and its myodermatome association is C3. Its elemental attribution is water, its polarity is yo or yang. Its effects include unconsciousness with possible long-term damage. On the Gogyo, you can see that we go from Kanke, which is wood, to Hike, which is earth, to Bokuke, which is water. Again, this is a very dangerous technique because of its use of bladder 10, so please do not strike it in actual practice. Okay, now we'll do a quick review of my yeti Bonkai. Again, from a front kick, you respond by breaking the shin by striking with your knee directly into the mid portion of the shin, which is the location of the liver 6 point. But also, it's also just plain located on the weakest part of the shin because it's structurally it's located directly in the middle of the shin, or close to the middle of the shin, which is structurally a very weak portion of the shin. So when he kicks, I strike directly with my knee, and if he kicks hard enough, he'll actually break his own tibia. So now I kick, and then I kick here with my toe. And that slightly turns his body, but at the same time I do that, my guard hand reaches out and turns his body even farther. If he has his guard down, go ahead, he kicks, I'll simply grab his shoulder and strike. If he's got his guard up again, I'll grab his upper arm and strike. Again, this motion where I grab and strike is just assuming a guard as we do our kick, like we do when we practice our basic warm-ups. So he kicks, I strike, strike, catch, strike. Again, striking Bokuke here, right on the inside of the hairline. We're going to bladder 10, which is a very, very dangerous point. It should never be struck in actual practice, but is an excellent point for self-defense. So one more time, let's switch sides. This same technique can be easily used from a shin kick to the outer thigh. He kicks my shin, ouch, so I don't like that. So I block now, intercept directly on the shin, and kick, oops, sorry, and kick follow up this way, and again strike right into bladder 10 right afterwards. So one more time, I intercept, kick, and follow up this way. So again, you can see that exactly the same motion works very easily to intercept a round kick as well as a front kick. Okinawan martial arts. There are many legends of karateka who cultivated the vital energy, or ki, in order to increase the effectiveness of their techniques or to withstand even the strongest blows. This ability included the ability to take
full power strikes to even vital areas such as the throat, the groin, the kidneys, the knees, or even Kyusho, or vital points. In this tape, we're going to discuss some of the basic theories as well as fundamental techniques of the Okinawan art of Kiko, or the cultivation of vital energy. In Okinawa, throughout the Orient, it is believed that breathing is the primary source of biological energy, or ki. Further, it is believed that the use of regulated forms of breathing, or kiko, can increase the amount of biological energy in the body. It is thought that every breath we take affects the energy balance throughout the whole body. When a person lacks ki, or has ki that is out of balance, that person will appear tired or sickly, and will quickly become vulnerable to illness. There are many forms of internal energy exercises, or kiko. We should perhaps begin with a discussion of some of the theories involved, and then move on to the most basic methods. In Okinawan Kiko theory, it is believed that the ki, or energy, is gathered in an area just below the navel called the tanden. It is from this area that the ki is thought to circulate through the two primary meridians of the acupuncture, and then to the 12 bilateral meridians. The tanden is also called kikai in acupuncture. This translates as sea of ki. This name indicates that this point is considered the storehouse of ki in acupuncture. In beginning exercises of kiko, the student practices breathing with the tanden, or lower abdomen. As they inhale, they visualize the ki going to the area of the navel, or just below the navel, which is the tanden. As they exhale, they allow their diaphragm to raise and the breath to go out towards their mouth. When inhaling, it's very important to let the abdomen distend slightly and to allow the diaphragm to lower. Most adults, when they breathe, actually breathe through their chest region. This is a byproduct of stress, and the more you breathe with your chest and the less with your abdomen, the more stress is indicated. By breathing with your abdomen, you're actually retraining your body to deal with stress in a natural way and training your body to relax. Abdominal breathing also greatly increases the percentage of the lungs used on each breath. Chest breathing uses only a small portion of the available lung capacity. Abdominal breathing uses nearly 100% of the lungs. Indeed, regular abdominal breathing can greatly increase the lung capacity. By focusing on breathing with the tanden, that is, imagining the breath gathering at the tanden, we are increasing the uptake of negative ions and oxygen, using a greater percentage of our lungs, gathering ki in the kikai, and teaching the body to relax on a somatic level. All of this adds up to an easy method to improve the general health of the practitioner, as well as building a foundation for later kiko work. Once sufficient ki has been built in the tanden, the kiko practitioner may begin Shoshuten Kiko, or a small cycle of the sky internal energy exercise. During Shoshuten Kiko, ki is led up Toku-myaku-kei, or the governor vessel. From there it is led down Min-myaku-kei, or the conception vessel. During Shoshuten Kiko, the ki is led through this cycle in a continuous route in harmony with the breath. It's believed that when the ki rises up Toku-myaku-kei, or the governor vessel, that the 6 positive or yo meridians of the body are benefited. These 6 meridians are the large intestine, the stomach, small intestine, the bladder, the triple warmer, and the gallbladder. It is believed that not only these meridians benefit, but their corresponding internal organs also become stronger. When the ki is led down Min-myaku-kei, it is believed the 6 negative meridians, or in-meridians, are benefited. These meridians are the lung, spleen, the heart, the kidney, the pericardium, and the liver. Like leading the ki through Toku-myaku-kei, it is believed that the internal organs corresponding with the meridians are benefited. So you can see that when the ki is led through the entire small circle, or the Shoshuten Kiko, all 12 bilateral meridians and the corresponding organs benefit. The next stage of Kiko training is Daishiten Kiko. It is begun after Shoshi Tenkiko training is complete. Daishi Tenkiko, or the large cycle of the sky, is a type of training in which the ki is led throughout the entire body. This is in contrast with the Shoshi Tenkiko, in which it is only led through the two primary meridians. In Daishi Tenkiko, we start by leading the ki up the foot, up the inside of the leg, then up the back, and out the inside of the arm. This represents the first stage of Daishi Tenkiko. The second stage we will do in a second. In the second stage of Daishi Tenkiko, the ki is led up the yo side of the arm, around the head, down the conception vessel, and down the yo side of the legs. At this point, the two stages of Daishi Tenkiko are joined into a continuous sequence. The ki is led throughout the entire body in a continuous cycle, much like Shoshi Tenkiko. Once the student has mastered this training, they can then move on to exercises based on Daishi Tenkiko, in which the ki system unifies the body as a single structure. In the next stage of Kiko training, the student practices what is called rooting. In this stage, he tries to unify his ki with the ground. In other words, he leads his ki to the ground. After he's become proficient, he can be tested by having somebody try to either push or pull in order to see if he can root his structure to the ground directly. This can only be done after Daishi Tenkiko training has been mastered. In the next stage of Kiko practice, the practitioner develops Bu-no Chikara by leading the ki throughout the entire body structure to the area being used. Bu-no Chikara can be tested through such exercises as Zun-Zuki or one-inch punch. Te no Omomi or Te no Omoi, or heavy hands, can also be developed through this type of training. Again, this training is derivative of Daishu Tenkiko training, and Daishu Tenkiko must first be practiced before this type of training can lead to any significant results. When first beginning tanden breathing, it's a useful practice to lay on the floor and place an object on your lower abdomen. Now practice breathing abdominally. If you do this correctly, you'll notice that the object on your abdomen raises and falls with every inhalation and exhalation. You should also notice the same raising and falling of the abdomen throughout the day as you breathe abdominally throughout the day. We'll demonstrate the first 4 basic Kiko exercises, which are designed to increase the lung capacity and improve the flexibility of the abdominal wall. In the first exercise, the aim of the exercise is to expel any stale ki or gaseous waste or toxins which are built up in the lungs. The reason that we do this is because most people don't exhale as completely as possible, and toxins and waste can build up in the bottoms of the lungs. And this exercise is designed to get rid of any waste which are in the lungs, as well as help to clear out any stale ki that might be there. So we'll just begin with the exercise and I'll explain it as we go. Inhale as my hands raised this way. So as I'm raising my hands, I'm also visualizing the ki going to the tanden. In all these exercises, that's the important point, is that you're visualizing the ki at the tanden. So as I inhale, I visualize the ki to the tanden, and I raise my arms. I go. Now I exhale. Now at this point, I start to bend over. And what this bending over does is it applies pressure to my abdomen. And this is going to help push on my diaphragm, helping me to expel more air than I normally would be able to. So what I'm going to do is bend forward and push my hands down as I exhale, and try to exhale as far as possible, well beyond where I normally would stop exhaling. So in order to expel any gaseous waste or stale ki, we're going to continue our exhalation beyond our normal point. So I'll demonstrate the entire exercise now. exercise, which is going to be repeated 10 times. So we'll do this cleansing breath, as I call it, to 10 repetitions in order to clear out any waste that might be in the lungs. The next of the set of 4 exercises is a full breath exercise in which we try to expand our abdomen and at the same time increase our lung capacity. We do this by inhaling beyond the point in which we normally would stop. So we're going to have basically the same hand motion without bending over. So I inhale, again visualizing the ki going to the tanden. My hands raised. When my hands raised, you can see this will stretch my rib cage, my intercostal muscles this way. This allows our ribs to expand farther and inhale more deeply and expand our lungs more greatly. So I inhale as I raise my arm, stretching my rib cage. I go. Again, the point is to extend the abdomen slightly and allow the ki to go into the tanden as we're stretching the intercostal muscles and trying to increase the lung capacity. A variation on this exercise, which is slightly more aggressive, which means that it also possibly could be more dangerous if you're in poor health or if you haven't done any previous work with abdominal breathing. It might actually strain your lungs somewhat. So you have to be very, very careful with it. But it is a very good exercise if done safely and slowly. It's essentially the same breathing exercise, but when we reach the top of our inhalation, in other words, when we normally wouldn't be able to inhale anymore, we're going to try to gulp down a little bit more air and hold it for a very brief time. The retention of the breath, or the holding of the breath, lasts from when my hands are here to when they're about parallel to the ground. So from here to when they're about straight out. I've retained the breath real briefly, that extra little gulp, to retain it for that brief time. And what that's going to do is push our diaphragm and our lungs down a little bit farther than we normally would. So I'm demonstrate now. So that's a variation of the full breath, which is slightly more aggressive, but can be done safely if done very slowly and you listen to your body. You always try to listen to your body. It'll tell you when you're going to the limit you probably shouldn't be approaching. For instance, you might feel a little dizziness, you might feel a little pressure in the abdomen or in the lungs, and those are all warning signs that perhaps doing the exercise a little bit too aggressively or too much or too long. So if you feel any dizziness, or any pressure, what that means is that you should either take a short break, just breathe normally for a few seconds and then continue, or that you're doing a version of the exercise that is perhaps a little bit too aggressive. So if you have any of those warning signs, either tone the exercise down somewhat, cut the number of repetitions, or do take a break. So those are the first 2 exercises. So we've done the cleansing breath in which we bend forward, push on the abdomen, the full breath in which we make a circle with the hand, expanding the rib cage, extending the abdomen. Now we're going to do what we call the gut suck. This exercise is designed to actually loosen the abdominal wall and loosen the diaphragm somewhat. The way we do that is we go down to a squatting position, which is called shikodashi. A lot of times we'll do basic and Okinawan styles. We'll do stretching exercises from the same posture, but what we're going to do is put our hands on our knees for support, and we're going to exhale as completely as possible. So I blow out, go course, all these exercises can be done silently. I'm making my breath more audible than normal so that the camera can pick it up. You can detect when inhalation and exhalation are taking place. But anyways, I exhale completely, then I cut off the air with my throat. In other words, I lock off my throat, so like when you swallow, so that you can't actually inhale. But I'm going to try to inhale even though it's cut off. And what that's going to do is going to create a negative pressure in my abdomen. And this negative pressure is going to actually pull my abdominal wall inwards and press my internal organs somewhere. It's actually going to pull my abdominal wall up and in. So, one more time. I bend down, I exhale. Now I inhale, I go. And I was pushing, so I hope you could see that my hand was actually going beyond my rib cage and even slightly up into my rib cage this way. I'm creating a very concave abdomen, which actually can go up this way, past my rib cage. And my diaphragm will curve this way, and I can actually put my hand underneath my sternum. I create a very concave abdomen. And this really loosens the abdominal wall and increases the flexibility of the diaphragm. But I've been doing it for a while, so don't try to get that kind of an effect right off the bat, because it could be unsafe, but you should have a slight concave. Your abdomen should become slightly concave. I'll do a couple repetitions. I blow out. I try to inhale with it locked off. I inhale again. I just take a normal breath. Then once again I inhale, exhale, and then I suck up again. Nice and relaxed. I'm going to do one more. Blow out. Here we go again. I suck. Okay, so now we've done 3 exercises. We've done bending forward, the cleansing breath. In other words, when we bend forward, push out more air. We've done the full breath, and we've done the gut suck. So those are the first 3 exercises. The 4th exercise is actually a repeat of the 2nd exercise. In other words, the full breath. So we do 10 repetitions of the cleansing breath, 10 repetitions of the full breath, 5 repetitions of the gut suck. You want to do a little less of the gut suck because it is an aggressive method and potentially could cause problems if you're in poor health or if your abdominal wall is not as loose or your internal organs aren't as flexible. So this one, consider the gut suck stretching. We'll talk a little bit more about the gut suck before I move on. You don't want to try to do the splits the first day. So if you joined a karate class and tried to do the splits the very first day you were in it, you would injure yourself. Well, your internal organs and your abdominal wall is the same way. If I try to increase the flexibility all at once the first day, I could actually injure myself. On the other hand, if I pursue stretching very gently, I actually benefit my body. I become healthier through stretching rather than injuring myself. The same thing with the gut suck. The gut suck can be very beneficial for the internal organs because as you get older, the fascia around the internal organs actually becomes somewhat stiff and can actually stick together. So this massaging action or this movement of the internal organs and the abdominal wall can actually keep the organs more healthy. You'll notice, pretend this is my abdominal wall. If I do the gut suck and I compress my internal organs, you can see how the blood will be forced out and allowed back in, forced out, allowed back in, forced out. That's going to help clear out any toxins in the internal organs. It's going to help increase blood flow to the internal organs and generally increase the health of all the organs. But at the same time, it's like stretching, like I said, you can also damage the internal organs if you stretch them too far too quickly. So it's very important to pursue that one very gently and then get good health benefits out of it rather than hurting yourself and having to quit your Kiko training for a few months. So after we've done the gut suck, then we do, like I said, the second set of the full breath, which is the second exercise we did. So again, just to recap, the full breath is when we inhale, and then deep exhale. So what we do, I'll do 1 repetition of each. you would do 10 of the first, 10 of the second, 5 of the third, 10 of the fourth. So, just one more time, we'll go 1, 10 repetitions of the cleansing breath. Full breath. Here's the full breath variation. So we do 10 repetitions of either one of those, but not both. Now we do 5 repetitions of the gut set. And again, this is performed in Shikodachi. And again, only 5 repetitions. And then we do 10 repetitions of the full breath again. So those are your 4 basic exercises. And again, the main intent is to loosen up the abdominal wall. This is very important. We want this to become loose. So when I exhale, it goes in. Inhale, it goes out. It's a very important principle for Kiko work. And at the same time, I increase the flexibility of my diaphragm and I increase my lung capacity. But a nice side benefit is I stretch the intercostals as well. So, and I increase the mobility and flexibility of my internal organs. So these exercises are very nice for all those things. But at the same time, we're building ki in the tanden, which forms the foundation for our later Kiko work. When I do, for instance, I do either Shoshiken Kiko, you need to first build ki in the tanden. So this builds a foundation for later work. So I increase my oxygen consumption. I shouldn't say consumption, but rather I'm able to assimilate oxygen more easily. I also can pick up more negative ions this way, and I reduce stress, and I help my body to relax on a somatic level rather than just an intellectual level, which is of course what we're actually aiming at when we try to relax. So these exercises are all very good in these respects and form a real good foundation for your Kiko work. So please pursue them, but pursue them very slowly and listen to your body. Your body knows a lot more about yourself than I do. So if something feels wrong to you, listen to your body, don't listen to me. And that's the 4 basics. But what you should also do when you're working at basic abdominal breathing is to remember breathe through your abdomen the entire day. Doing 3 repetitions of 4 sets as a 4 breath set isn't going to do you anything. You should do your 4 basic exercises in the morning, then in the afternoon, and then in the evening. But doing just those 3 sets isn't going to do you anything. What you really have to work on is building ki in your tanden the entire day. If you don't do that, you're not going to get the results that you need. So you should work on that the entire day, allowing your abdomen to distend and retract as you breathe. So that might mean that you have to buy a little looser clothes, or at least take your belt a notch back, so that you actually are wearing clothes that don't restrict your breathing. If your clothes restrict your breathing, you're not going to have a lot of luck with your Kiko work. Something else you can do to make your Kiko more integrated in karate is do stretching exercises as Kiko exercises. Originally, in Okinawa, most stretching exercises were done as a form of Kiko, or done as a type of tanden breathing. The breath is coordinated with the movement. For instance, a very common stretching motion that you'll see in a lot of different styles is simply to circle the body. However, this should really be done with coordination of breath. I should inhale as my ribs expand and exhale as they contract. And I should, of course, do both times. So this basic stretching exercise can easily be done as a form of Kiko. If I sit down, and I do hamstring stretches, again, this is the type of Kiko abdominal work that we can easily integrate into our movement. So I'll exhale, inhale, exhale, inhale. And again, it's a very easy thing to do. All of our basic stretches
can be done as a type of kiko. This goes for your arm stretches, your back stretches, everything. Basic back stretches, you can inhale. Exhale. Same thing when I go forward. In fact, our exhalation breath can actually act as a hamstring stretch if we keep our knees straight. So all of your basic stretching exercises can be done as a type of kiko. So use the ones that you have in your dojo, whatever you're already doing, but do them as a form of abdominal breathing. I'd like to do one more type of abdominal breathing as a stretch, though, because I think it's a very nice type. It works well for dojos that do a lot of tuite because it stretches and strengthens the wrist and the fingers, as well as improving the grip. So the dojos that do tuite are going to find this a beneficial exercise, and it actually is a form of kiko also, so it's a very nice exercise. Demonstrate sideways, might be easiest to see. Put your hands together, pull them back, and then stretch the thumb. Now we'll raise our hands, turn our hands upward, and now this will be the formal start of the exercise. I breathe in as I raise my hand, and then they separate. They separate slightly like this. Then they come together, and this is all during the inhalation phase. They come together. Now my exhalation phase starts. And you can see what I've done here now. I'm stretching my fingers. You can see how my fingers are stretched. And my thumbs simultaneously. This is a wrist stretch. You can see I feel tension here and here. I'm stretching both parts of my wrist this way. And now I'm stretching my fingers. So, again. Now, from this point, I bring my hands this way. What I'm going to do is start with my little finger in and then make a tight grip. So this is actually a grip exercise. And as I do this, I'm going to coordinate with breathing again. So we went on stretching the wrist, now we're working on grip strength. But what we're going to do again is coordinate with our breath. So this is very important. So after we bring our hands here, we'll just bring them up this way. Now, I'm going to exhale as my hands are open, inhale as they close. I'm sorry, I did that wrong. I'm going to exhale as they're open, and then inhale as they close. I don't know if I said that wrong or not. The last version is right. So what we're going to do now is go inhale, exhale, inhale, opposite. I'm going to close my index finger in first and exhale as I close. So I go. And you'll notice a lot of tension in my arms, but that's the only part of the body that's tense. You don't want to tense your throat or your abdomen or your legs. Your genital diaphragm, anus. None of those things are tense. You can allow, especially for people who've already done Shotokan kiko, but if you haven't, it doesn't matter, you can still do it. You can allow slight hip action this way, but you should not use any tension when you do that motion. The only thing that's being tense is the hand. You're just working on grip strength if you're not doing anything more. So that's a real nice exercise. And again, we do the wrist and finger stretches first, and after you've done, say, 10 repetitions, then you do 10 repetitions with the little finger in, and 10 repetitions with the index finger in. So that's a real easy stretching exercise that also
Shotokan Kiko, as well as Shotokan Kiko itself. Thank you.
Anyone hear of Qigong? Okay. Okinawa, it's called Kiko, same characters, same basic idea. Sanchin, anyone ever hear of Sanchin? Okay, that's a form of Kiko. It's a little bit harder than what we do in Shonru, but they do the basic same ideas. Okay. Turn it to the mic, please. I'm not wearing a cup, okay? So no trick.
You mean the top of my foot?
Yeah, just use your shin iron step, whichever you're comfortable with. Okay. No, hard, please.
Really?
As hard as you can, please. Lift me, you're bigger than that.
Ask his wife. Yeah. Go ahead, Dave.
Hey. Please again. Hey. Okay. Same thing works any part of the body.
Anywhere down to the end of the muscle system. Kicking. Inside, outside, outside.
You're in the camera.
Get a different angle, Barb?
Yeah. There's a little bit left.
A little bit. Okay, we'll do quick. Ribs, side. Front kicks, ladder, whatever. I haven't got the root down yet. Try not to move much. Can I get 4 people on each side of my head, please? 6 times. Otherwise, okay, let's do it one more time. Otherwise, he'll hit me, and I'll go like this. Yeah. Right? 5.